Committee on Health, Education, Labor, and Pensions will come to order. This morning, we will be considering 6 bipartisan reauthorizations, and I'm pleased that we are voting on these bills today. And I just want to take a moment to thank my staff and Senator Cassidy's staff who put a whole lot of work into making these bills possible. First 2 bills we are considering today are S-133 and S-134, a reauthorization of the National Alzheimer's Project led by Senators Collins and Warner, and the Alzheimer's Accountability and Investment Act led by Senator Collins and Markey. Senators Collins, Markey, and Warner are all co-chairs of the Congressional Task Force on Alzheimer's Disease. These bills reauthorize the National Alzheimer's Project through 2035, expand the Associated Advisory Council, and require NIH to submit an annual professional judgment budget estimate for related initiatives directly to Congress. Alzheimer's, as we all know, is a terrible disease. An estimated 6.7 million Americans are living with Alzheimer's, and experts estimate that number to increase to nearly 13 million by 2050. I urge my colleagues to support these bills and thank my colleagues, particularly Senators Collins and Markey, for their bipartisan leadership on this issue. The next bill we will be considering today is S-265, the Supporting and Improving Rural EMS Needs Reauthorization Act. That's led by Senators Durbin and Collins. This bill extends a grant program for emergency medical services in rural areas through fiscal year 2028. EMS organizations across the country, as I trust anyone who lives in rural America knows, are in a state of crisis. Overall turnover among paramedics and EMTs ranges from 20 to 30% every year. This program makes sure that people who live in rural areas have the emergency medical staff, volunteers, and equipment they need to provide critical care for their communities. This bill also updates the program by making sure that EMS personnel are trained to care for individuals with mental health and substance use disorders during an emergency, and allowing the use of grant funds to acquire overdose reversal drugs and devices. The next bill we will be voting on today is the Animal Drug and Animal Generic Drug User Fee Amendments Act of 2023, and that's been introduced by Senators Baldwin and Mullen. This bill reauthorizes FDA's user fee programs for veterinary drugs that our nation's farmers and families need for their animals and their pets. We will also be taking a vote on a very good amendment from Senators Marshall and Baldwin that would allow the FDA to approve products that are necessary not just for animals, but for farmers and people as well. These food additives could, for example, reduce salmonella in chickens or encourage milk production in cows. This is a common-sense bipartisan proposal, and I urge my colleagues to support it. The next bill we are considering today is the Sickle Cell Disease and Other Heritable Blood Disorders Research, Surveillance, Prevention, and Treatment Act of 2023, led by Senators Tim Scott and Booker. This bill would extend the program to treat sickle cell disease and prevent and treat complications from sickle cell disease. Sickle cell disease is a common inherited blood disorder that can, in some people, cause chronic pain and other serious health problems. I strongly support extending and expanding this program to improve our efforts to treat this disease. Last but not least, the 6th bill we will be taking up today is S-1855, the Special Diabetes Program Reauthorization Act of 2023, led by Senators Collins and Shaheen. This bill will increase funding for the Special Diabetics Program at NIH and the Indian Health Service to make sure that important work to cure, treat, and prevent type 1 diabetes will continue. I support these bills, and I believe they should be signed into law as soon as possible. Senator Cassidy, the mic is yours.